I have worked at Southeast Community Health Systems for 2 years as its CEO. I'm actually beginning my second year now, and we provide behavioral health, medical, as well as dental services to the patient populations that we serve. We have 7 clinics that we operate. 2 of our clinics are school-based clinics, and we serve communities in 4 different parishes that we serve. I've had the opportunity of working with 2 medical psychologists going into my second year, and work real closely with the director of behavioral health in that area. And I also have over 15 years of experience working in higher ed and supervising counseling centers with psychologists and medical psychologists as well. I would say to the state legislators and the community members in Nebraska to not be afraid, to trust trained and credentialed professionals to provide care, much needed care, particularly behavioral health care, to the patient populations in Nebraska. And to know that medical psychologists will work in collaboration with medical doctors as well as nurse practitioners in doing their jobs.
I'm a family nurse practitioner with Southeast Community Health Systems. I have been working here since 2004. Let me think. The medical psychologist came on board, I actually don't know the year. I was going to say I think it's about 5 years. I didn't start out with any concerns really about working with medical psychologists. If there was someone who could help me with all of these patients that I had with mental health needs, then I was more than welcome to see how it would work. So I didn't really have any concerns initially. Now, once we started working together, we had some growing pains and some things to work through, but it has been an absolute blessing. Okay, the medical psychologists have truly closed the gap in the underserved population. I worked here from, so that's 2004 to 2000, I don't know, probably a number of years without having a behavioral health person on staff. A large portion of our patients are uninsured or underinsured. And as I've complained many times, it seems like every year mental health services are cut more and more and more and more. So you try to find some help for these people, and it is probably the most frustrating thing I've ever experienced in my entire life. I mean, these are patients that I cry with. I mean, and I can't do anything for them other than talk to them myself and give them medicines that and prescribe medications. I can't even describe the frustration and the heartbreak in trying to help those people. So, and then suddenly here the medical psychologists were not like they're riding in on mounted chargers, but it's worked beautifully. Like I said, we of course had growing pains in the beginning, but they're there, and they get their schedules are full. Their schedules are overrunning. But if I have someone who needs to be seen right away, I can pick up the phone and call, and we make some adjustments so we get them seen. Or I'll go ahead and start medication. If I have a question about that, I'll call them. They're always right there. Pick up the phone, run through it with me. We decide on a treatment plan, an initial treatment plan, until they can be seen by them. Where would those people go otherwise? There's no one to the emergency room. I mean, where would they go? There was nowhere. There have really been no problems. Our psychologists are really very good and very knowledgeable. And a lot of times they'll go ahead and they'll order their own lab work, their own EKGs when they're prescribing medications that they know have certain adverse effects. But the awesome thing about them being with us is their patients are our patients too. So we're seeing them, just like I pick up the phone and call them if I have a question about a mental health patient. They email, pick up the phone, call. We see if a patient comes in to see them, they get worked up just like a medical patient. So their vital signs are taken, whatever. I can't tell you the number of patients who've had sky-high blood pressures when they come in that otherwise wouldn't have been caught. So they walk over, they pick up the phone and call, and we work together and take care of their medical needs as well as their mental health needs. It really works beautifully. It makes me think about, years ago when they didn't think nurse practitioners should treat some of those same populations. But we have special training to treat pediatrics, to treat geriatrics. And very obviously, they've had the same. I've not come across, I haven't had one patient have a bad outcome because of medications that they've prescribed. And y'all, the kids at the schools, there's so many of those kids with so many problems. It's so sad to say, and I can't tell you enough how much they fill that gap. I have seen so many of my patients just get so much better. I mean, they come in and they're so depressed, they're so anxious. We have a young teenager who's schizophrenic, and his poor grandmother. I mean, he would just. They took him out of school because he would just get up and run out of school and out into the streets, and they couldn't do anything with him. We were trying so hard, and we picked up the phone, we called, started some medicine, got him an appointment the next week. He's a different kid. He's back in school. He can talk to you. You can have a conversation with him. You couldn't do that before. And where would that child have gone? None of us are perfect. None of us know everything, obviously. But the medical psychologists have filled a gap that would not have been filled otherwise. They're intelligent. They know what they're doing. If they don't know something, they find out. They ask. They collaborate with our medical director or with colleagues, just as I do. I mean, there's absolutely no reason to have concerns or to be afraid of that. It's win-win for everyone.
Hello, I'm Dr. John Fidanza, and I am a medical psychologist, advanced practice, and I reside in Zachary, Louisiana, and I'm the director of behavioral health for a large federally qualified health clinic. I originally from Kentucky, where I was licensed as a clinical psychologist, and presently I am covering 8 clinics in southern Louisiana and across 3 parishes. And I was recruited to come to Louisiana to work in a rural health clinic. We are a federally qualified health clinic that serves the underserved population. And for those patients that live in rural communities that do not have access to psychiatrists or prescribers. And so each day we travel to the underserved areas to be able to meet the needs of those patients. And we feel like we are closing the gap because these patients do not have access. They would not have access otherwise. Because I am a medical psychologist, and those of us who are medical psychologists, we have the option also to do psychotherapy. We provide psychotherapeutic services. We don't just prescribe. Again, most of us ascribe to the slogan or the motto that the power to prescribe is also the power to not prescribe. And so therefore, we are able to utilize psychotherapy, and if we need to see a patient weekly, we will. If we need to see a patient bi-weekly, we will. If we need to see a patient monthly or quarterly, if it's just medication management, we will do that. The skill set and the training involved in becoming a clinical psychologist clearly encompasses numerous hours, practicum, internship, educational coursework to be able to develop the interventions and diagnostic skills to treat our patients and to help them develop the coping skills necessary to work through trauma, conflict, everyday psychosocial stressors that adversely impact their physical and psychological well-being. To be able to have the psychopharmacological and the medical training to work closely with other healthcare professionals and prescribe medication, or to taper these patients off medication that is unnecessary or has adverse drug reactions, is a blessing. And to be able to combine the psychotherapeutic skills with the psychopharmacological skills offers an added benefit to our patients, because we are already trained in how to provide psychotherapy. To be able to have an additional skill set that will help our patients is something that our patients are very grateful on a regular basis.
We introduced our bill and passed our bill in 2004 and became a medical psychologist in 2005 when we implemented our bill. So I've been prescribing as a prescribing psychologist now for the past 10 years, going on 11 years now. When passing that bill, we wanted to ensure that we did something to help in dealing with the epidemic of mental illness in this state. And one of the charges that some of our legislators gave us was, you say that you're going to increase access to people who need mental health services. If we do this, will you indeed increase access to mental health services? And that was a charge that we took very seriously. So our issue was we would provide greater access. Well, indeed, what we have done is provide greater access in terms of less waiting time for many patients. And one of the things that's important, I mentioned before, I am now under contract with the state for providing services in the community mental health center. Our community mental health center in Lafayette, Louisiana, where I practice, covers a 7-parish area. Okay? Parish for people in Nebraska is going to be counties, okay? 7-county area. That includes very rural places that do not have access. And you say, well, psychiatry was doing that too. Yeah, but at our community mental health center, there were vacancies for psychiatry for 5 to 10 years. They were unable to fill those vacancies. Now, medical psychologists are able to help out. Medical psychology is not the answer to the access problem. It's not the answer to the mental illness problem, but it's a part of the answer. So psychologists with prescriptive authority, that can be part of the solution, not the entire solution, but part of the solution. So that I was able to see patients from rural areas that I probably would never have seen without prescriptive authority. B, we have satellite clinics that some of our medical psychologists provide services there, so that there is access to prescribers in rural and underserved communities. In New Orleans, which has very poor communities as well, we have medical psychologists prescribing there. So that we have indeed kept our promise to our governor, who signed our legislation, by increasing the access to both rural and the underserved. Our opponents will oftentimes say, well, there are no more psychologists in rural areas than there are psychiatrists.
Right.
And generally, that's not the case. Generally, there are more psychologists, but it doesn't mean it'll be a medical psychologist or someone who has prescriptive authority. There may be psychologists in rural areas. But psychologists now with prescriptive authority are covering these rural parishes that they had not covered before. So we are indeed providing greater access to patients with the prescriptive authority. Okay, how have physicians shown support? Well, there are a couple of areas. Obviously, not every physician supports it. The medical schools do not support it, which is, I think, understandable. The medical society has been somewhat lukewarm on it. We are now governed by the state medical board, so the medical society is kind of warming up to medical psychologist prescribing. Meaning the medical board, have recognized that we are a pretty good regulatory people, that psychologists are very ethical, and psychologists are folks who generally abide by regulations and rules and regulations, so they have no problems with us. The other thing that I think is important is that there's a difference between organized medicine, that you will find organized medicine may be opposed to a lot of things. And the difference between organized medicine and your local physician. Okay, I've heard the adage in the doctor's dining room. Sometimes I'll eat in the hospital doctor's dining room, and the doctors will say, "Well, we don't mind if you do it because we know you, but we don't know about those other people out there." Once they get to know us, once they know that we are safe prescribers, they are fine with it. Most of the physicians in the medical community are fine with it, but if you talk to organized medicine or the medical schools, they may be opposed. The executive director of the State Medical Society at the time testified before the legislature that we were safe prescribers. So for the physician who is the medical executive of the State Medical Society to say that we recognize medical psychologists are safe prescribers, that was an important relationship for us to establish. And that relationship has just blossomed, I think 100-fold. The experience of prescribing is just a tool. It's just a tool, okay? What I oftentimes say is it's a tool for psychologists to use if you are appropriately trained to be able to use that tool. But the good thing about psychologists with prescriptive authority is we have more than that one tool to use, okay? The other thing that's extremely important is psychologists with prescriptive authority are excellent at using the right tool for the right problem. We have more than one tool to use. We want to use the tool that meets the patient's needs rather than force the patient into the only tool that we have. Okay? If I have only one tool, if I only have a hammer, the whole world becomes a nail, right? So, but if I have multiple tools, I can do some things to help your need, which may not need that hammer, may need something different.